viewers. Good day to all of you. Today I am going to continue with the second part of the sole of the foot. Okay, so as a continuation of the second part, our learning objectives for today will be mainly on the lumbrical muscles, which we have not discussed in our previous class, and it also comes on the second layer of the sole of the foot. Then followed by lumbricals, I will be discussing about the last layer, that is the fourth layer, the muscles which are present on the fourth layer of the sole. Then followed by that, we will be discussing in detail about the course and branches of the nerves and vessels of the sole of the foot, and finally a few applied aspects relating to the sole we will be discussing. Now, so as this is a continuation of the previous class, it would be necessary to have a brief recap or recollecting of the previous aspects which we have discussed in the first part of the sole. So mainly the skin of the sole is very thick. It is a non-hairy skin. It is attached deeply to the plantar aponeurosis, which gives a firm grip to the skin. Then the next important structure which is present, we have discussed in detail about the plantar aponeurosis. It is a modification of the deep fascia and its attachments and its extensions. We have all discussed in detail its function, protection of the digital vessels and nerves, providing grip to the skin of the sole of the foot, and mainly as a tie beam, it is responsible for maintaining the longitudinal arch of the foot. So these are the three main functions of the plantar aponeurosis. Then we have seen that the muscles are actually present in four layers, and the four layers are, in the first layer we have seen three muscles, intrinsic muscles. So intrinsic muscles means the name applies to intrinsic in any region, which means that the muscles origin and end in the same region. They are confined to the same region and they don't come from the above or below region or cross that region. Okay, so that is the meaning of intrinsic muscles. So the three muscles which we have seen here is the mainly your abductor hallucis, abductor digiti minimi, and flexor digitorum brevis. The second layer we have seen two tendons, flexor digitorum longus and flexor hallucis longus. With respect to the flexor digitorum longus, again two muscles were attached. One is the flexor accessorius and other one is the lumbrical muscles, which we are going to actually discuss today. Then the nerves and vessels are actually present between the first and the second layer of the sole of the foot. Okay, so between the first and second layer you see the vessels and nerves, but the deep branches of these vessels and nerves are actually seen deep to the adductor hallucis. So that means it is deep to the third layer and it is present between the third and fourth layer, the deep branches. But the main trunk of the nerve and vessel is actually present between the first and the second layer. Then we have seen about muscles on the third layer of the sole of the foot. They are confined or starting from the metatarsal bones. Mainly we have seen about the three muscles, two muscles to the great toe, flexor hallucis brevis, adductor hallucis, then we have seen flexor digiti minimi. Okay, so these three muscles we have seen, two muscles to the great toe, which is the flexor hallucis brevis and the adductor hallucis, and one muscle to the little toe. So that is up to third layer we have finished. Now coming to the fourth layer, or before going to the fourth layer, since we have not discussed about the lumbricals. Now basically why I have reserved the discussion of lumbricals to this layer, even though it does not belong to the fourth layer, why I made it a point to discuss in this second part of the soul of the classes. Now these lumbricals, your interossei muscles, your plantar interossei and the dorsal interossei. So all these muscles, they have a common function and they insert via the dorsal digital expansion. So same like your lumbricals and palmar and dorsal interossei of the upper limb in the palm, in the same way, but only difference is the nerve supply and their architecture is slightly different. And third one is they don't bring very fine movements as in the upper limb. In the upper limb, mainly what happens is they are mainly to bring about the finer movements for any skilled activity. But here what happens is these lumbricals, plantar and dorsal interossei, they do their prime action, and apart from that they insert via the dorsal digital expansion, thereby they prevent the buckling of your toes during the plantar flexion. Okay, the toes while you walking, what happens, it should not get buckled or folded under your feet. So that is one main action these muscles perform. So if you look at the lumbricals, they are again numbered 1 to 4 from medial to lateral, not as lateral to medial in case of the upper limb. So from the medial side, first lumbrical, second lumbrical, third lumbrical and fourth lumbricals. If you look at the lumbricals again, the first lumbrical arises from the medial side of the, all lumbricals arise from the tendon of the flexor digitorum longus, but the first one is a unipinnate muscle. Okay, the first one is a unipinnate and just arises only from the medial side of the tendon of flexor digitorum longus for the second toe, whereas the second, third and fourth lumbrical muscle, they arise from the adjacent sides of the second, third and fourth tendons of flexor digitorum longus. So first is a unipinnate, the remaining three are actually bipinnate. Now where do they go and insert? The first one is, second one, third and the fourth, all are getting inserted into the medial side of the proximal phalanx. Okay, it is getting inserted into the medial side of the proximal phalanx, and they also have an action on the distal phalanx via the dorsal digital expansion. Okay, so the muscles getting inserted into the dorsal digital expansion is your lumbricals, your palmar interossei, your dorsal interossei, and apart from that, via the dorsal digital expansion, even your long extensor and the flexor tendons are also attached. Okay, so it becomes, what happens, the dorsal digital expansion serves as a balance between your flexor and extensor tendon. So that is why what happens is all your toes are straight. Otherwise what happens is, if there is no dorsal digital expansion, whether the flexor or extensor during any movement might take a dominance. So the first lumbrical will be supplied by the medial plantar nerve, and remaining the rest of the lumbricals will be supplied by the lateral plantar nerve. Okay, the first lumbrical alone is supplied by the medial plantar nerve. So mainly plantar flexion at the metatarsophalangeal joint and extension at the interphalangeal joint. Same like your lumbricals of the palm, they also bring out flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. So it has the same action. Okay. Through the dorsal digital expansion, as I told you, since it has an action over the interphalangeal joints also. So 4 lumbricals. First is unipinnate, the remaining 3 are bipinnate. In the upper limb, the first 2 are unipinnate, the remaining 2 are bipinnate. The nerve supply also slightly differs in the upper limb. The first 2 is actually supplied by median nerve and the lateral 2 is supplied by the ulnar nerve. But here only the first one by the medial plantar nerve and the lateral 3 is actually by the lateral plantar nerve. So with this, we will pass on to the 4th layer of the sole of the foot. You have again 2 tendons. Tendon of peroneus longus. You have the tendon of peroneus longus. Then the tendon of tibialis posterior. Peroneus longus and the tibialis posterior. 2 tendons you have. And the intrinsic muscles are the plantar and the dorsal interossei. Here you are able to see that is actually the dorsal interossei. There are 3 plantar interossei and 4 dorsal interossei. 3 plantar and 4 dorsal interossei. The first and the second is supplied by the lateral plantar nerve and the third is actually supplied by the superficial branch. But remember, as a rule, all the plantar interossei and dorsal interossei are supplied by the lateral plantar nerve only, whether it is superficial or deep branch. Okay. So dorsal interossei mainly you are able to see here is the dorsal interossei. They are actually 4 in number. Again they are supplied by the lateral plantar nerve only. It's a slight reverse. Here actually the medial 3 are supplied by deep branch of the lateral plantar nerve and the last interossei will be supplied by the superficial branch of the lateral plantar nerve. This is the dorsal interossei for you from medial to lateral. 1, 2, 3 and 4 dorsal interossei. Before slide what you have seen is the plantar interosseus. Okay. So that is the plantar interossei which you are able to see 3 plantar interossei and 4 dorsal interosseus. Now coming to the plantar interosseus, interossei is a plural, interosseus is a singular pronunciation, that is how you pronounce. They actually arise from the metatarsal bones. 3 plantar interossei for the second, third and the 4th toe. 3 plantar interossei. They are all unipinnate muscles. Same like that of your palm, upper limb. From the medial side of the 3rd, 4th and 5th metatarsal, again they are going to get inserted into the proximal phalanx only on the medial side. Okay, so medial side of the proximal phalanx of the 3rd, 4th and the 5th toes. You know their action. So when this muscle acts, it is going to bring adduction. The 3 plantar interossei are adductors of the lateral 3 toes. The lateral 3 toes are actually adducted by this plantar interossei. So you might wonder why there is no plantar interossei for the first toe and the second toe. The first toe you have adductor pollicis separately, thereby it can be adducted. Okay. The second toe is actually falls in the line of the axis of the foot. So thereby the first toe has to be adducted towards the second toe the third, fourth, fifth also has to be approximated or adducted towards the second toe. So thereby what happens is the second toe, if at all it has to move either ways, it will be only abduction. It cannot be adducted onto itself. So that is why there is no interossei, plantar interossei for the second toe, and first toe you have adductor pollicis separately. Coming to the nerve supply, so the first and second is supplied by the deep branch of the lateral plantar nerve, whereas the superficial branch of the lateral plantar nerve supplies the third interossei, plantar interossei. Whatever it might be, all three plantar interossei are supplied by the lateral plantar nerve. Coming to the dorsal interossei, they are all bipinnate muscles. You are able to see the dorsal interossei are actually bipinnate muscles. They are well appreciated in the dorsum of foot. The dorsum of foot, you can see them, but if you want to see them on the sole aspect, then you have to dissect and go up to the deepest layer, fourth layer. So origin, since it is a bipinnate muscle, from the adjacent sides of the metatarsal bones, from the first, second, third, fourth, and the fourth and fifth metatarsals. Then what happens is, first dorsal interossei attaches to the medial side of the proximal phalanx. Second one gets inserted into the lateral side of the proximal phalanx for the second toe. So two dorsal interossei for the second toe. Now you know why actually there is two dorsal interossei for the second toe, because it has to be pulled either side if it has to be abducted. These are all abductors of the toes. Okay. So when this first interossei is acting, it will pull or abduct the second toe towards the great toe. The second dorsal interossei, it will abduct the second toe towards the third toe. Okay, same like your upper limb. So that is why if you have understood the concepts of upper limb, then lower limb 60 to 70% is the same. Okay, only with some variations. Now here it is the second toe, in the upper limb it is the middle finger, which is your third digit. Okay. Then what happens is, third, fourth and fifth dorsal interossei, they are getting attached to the lateral side of the proximal phalanx of second, third and fourth toes, lateral side. Okay. Now you might again wonder what happened to this one. There is no dorsal interossei, but again you have abductor hallucis. So abductor hallucis muscle brings about the abduction of the great toe. Same way this has got its own abductor digiti minimi. So these two we have seen in the first layer of the sole of the foot. Since the first toe and the fifth or the little toe has its own abductors in the form of abductor hallucis and abductor digiti minimi, the remaining four dorsal interossei are only for the second, third and the fourth toes. And of course, apart from the proximal phalanx, they also insert into the dorsal digital expansion. All the plantar dorsal interossei are again supplied by the lateral plantar nerve. The first three is by the deep branch and the fourth one is by the superficial branch. So that is about the mainly the intrinsic muscles which is present in the fourth layer of the sole of the foot. Coming to the tendons. So before that, three plantar and four dorsal interossei, they are abductors of the third, fourth and fifth, which is your dorsal interossei, whereas the plantar interossei are adductors of these three, the third, fourth and fifth. They also prevent opposive extension at the metatarsophalangeal joints and excessive flexion. So that is what I told you. Through the dorsal digital expansion, they are able to bring about this action and prevent the buckling of toes underneath your feet. Now, the tendon of peroneus longus, you are able to see this is the tendon. It actually passes in an osseofibrous tunnel beneath the cuboid bone, and then it travels medially and is getting inserted into the first metatarsal and the medial cuneiform. The first metatarsal and the medial cuneiform, the tendon of peroneus longus. Okay. The tendon of tibialis posterior from deep to the flexor retinaculum, the primary insertion is into the navicular tuberosity of the navicular bone. The remaining fibers, they span out and attach to the all tarsal and the metatarsals except the talus and the fifth metatarsal. Okay. Apart from the or exception is the talus and the fifth metatarsal, it is giving tendinous insertion into the all the tarsal bones, three cuneiforms, navicular, cuboid and calcaneum, and to the medial four metatarsal bones. Now we can see the tendons of the peroneus longus and the tibialis posterior, they actually cross like an X manner. Are you able to understand? And they are responsible for maintaining the longitudinal arch, and peroneus longus is also responsible for maintaining the transverse arch of the foot. Okay, the transverse arch of the foot. So that is about the muscles of the fourth layer of the sole of the foot. So now we will come to the neurovascular structures which are present in the sole of the foot. The first we are going to see about the lateral plantar nerve, the medial plantar nerve. So the sole is supplied by two nerves, the medial plantar and the lateral plantar nerve. They are branches of the tibial nerve. They are actually branches of the tibial nerve, and they divide underneath the flexor retinaculum. Okay. The medial plantar nerve is the larger terminal branch of the posterior tibial nerve, or simply called as the tibial nerve, because the anterior tibial nerve we usually refer it as the deep peroneal nerve. Peroneal nerve which divides into the deep peroneal and the superficial peroneal. Okay. So this is actually your medial plantar nerve, the larger terminal branch. Enters the footway deep to the flexor retinaculum. Okay, and passes forward deep to the abductor hallucis. Deep to the abductor hallucis muscle, and then what happens? It terminates at the base of the metatarsals by dividing into three plantar digital nerves. Okay, 1, 2 and 3 plantar digital nerves. So here you are able to see the medial plantar nerve from the flexor retinaculum deep to the abductor hallucis, and then it runs in the first and second layer of sole of foot at the base of the metatarsals. It terminates by dividing into three plantar digital nerves, first, second and third. Thereby it supplies the adjacent sides. It is actually going to supply the adjacent sides, these plantar digital nerves. Sorry, this is the medial plantar nerve. I have been showing this. This is the medial plantar nerve dividing into, here the continuity is actually lost, but three plantar digital nerves it gives, supplying the adjacent sides of the great and the second and third and fourth. Proper plantar digital nerve to the medial side of the great toe. Separately it gives a proper plantar digital nerve to the medial side of the great toe. So thereby it supplies the medial 3.5 digits. The medial 3.5 digits is actually supplied by the medial plantar nerve. So this how it is supplying. So let us see the branches given by the medial plantar nerve. So mainly it supplies 4 muscles. Only the 4 muscles it supplies. Abductor hallucis, which we have already seen. Then it will actually supply your flexor digitorum brevis. This is also a muscle in the first layer of the sole of the foot. Flexor hallucis brevis, which is in the third layer, and then first lumbrical. Okay, abductor hallucis, flexor digitorum brevis, flexor hallucis brevis, and the first lumbrical. It will supply the 4 muscles. Plantar cutaneous branches medial side and also to the medial border of the great toe on the sole of the foot. Then digital nerves, as I told you, 1 proper palmar digital nerve and 3 common palmar digital nerves. Okay. The 3 common palmar digital nerves will again divide into, in the interdigital spaces, it will divide into the proper palmar digital to the adjacent sides of the toe, second, third and fourth. Thereby it supplies the 3.5 toes. The first common palmar digital nerve will also supply or give a branch to the first lumbrical muscle. It will give a branch to the first lumbrical muscle. Okay. So even though it is considered as the larger terminal branch, the medial plantar nerve, but the motor supply, it is only supplying the 4 muscles, but the digits, 3.5 digits it supplies. So articular branches to the intertarsal and tarso-metatarsal joints, mainly to the first toe. So this medial plantar nerve can be compared to the median nerve of your palm. Proper palmar digital nerve, common palmar digital nerve, 3 in numbers, and they again divide into proper palmar to the adjacent. This first common palmar will again give a branch to the first lumbrical muscle. So that is the medial plantar nerve for you behind the or deep to the adductor hallucis. The next nerve which we are going to see is the lateral plantar nerve. The lateral plantar nerve also it's again a branch of the tibial nerve or the posterior tibial nerve passing deep to the flexor retinaculum. Considered as the smaller terminal branch, or it can be compared to the ulnar nerve because it only supplies the most of the muscles in the sole of the foot. So deep to the flexor retinaculum, then again it has to pass deep to the abductor hallucis and then it has to come laterally. At the base of the 5th metatarsal bone, it divides into a superficial and a deep branch. So it divides into a superficial branch and then it gives a deep branch, which you are able to see here. The superficial branch divides into 2 plantar nerves. You are able to see one is actually the proper plantar nerve to the lateral side of the little toe and one common palmar branch to the adjacent sides of the little toe and the 4th toe. Okay. And it also, before that, it divides into a lateral and a medial branch. It is the lateral branch which is going to supply this and also the flexor digiti minimi brevis. The medial branch, what happens is, it divides into 2 and supplies the adjacent sides of the 4th and the little toe and communicates with the plantar digital branch of the medial plantar nerve. So it will have a communication with the nearest branch of the medial plantar nerve. So this we have already, same like there is a communicating loop between the median nerve and the ulnar nerve. Here also we have a communicating branch. So branches, muscular branches, we all know apart from that four muscles, it is actually going to supply your flexor accessorius muscle, then abductor digiti minimi, it is going to supply your adductor pollicis, flexor digiti minimi brevis, 3 plantar interossei, 4 dorsal interossei, and the lateral lumbricals, second, third and fourth, except the first, lumbricals. So most of the intrinsic muscles of the sole of the foot is actually supplied by the lateral plantar nerve. You are able to see that is the superficial branch which is dividing into a lateral and a medial branch, and that is the deep branch which lies within the concavity of the plantar arch, exactly like your ulnar nerve, deep branch of ulnar nerve, again lying within the concavity of the deep palmar arch. Here it is lying within the concavity of the plantar arch, and this is actually present deep to the adductor hallucis. So between the third and the fourth layer of the sole of the foot. Okay. So thereby through this it is going to supply your the dorsal interossei and the plantar interossei and the second, third and fourth lumbricals. It also gives, as I told you, lateral third of the sole of the foot, skin over the lateral third and the lateral 1.5 digits. That is the lateral side of the toe, little toe and the fourth and adjacent sides, 1.5 digits, it also supplies. And of course these plantar digital nerves, they also supply your dorsal aspect of your nail bed region of the toes. So with this, the medial plantar nerve and the lateral plantar nerve, the distribution of the superficial and the deep branch which we are seeing for the lateral plantar nerve. We will pass on to the arteries. The medial and the lateral plantar arteries, they are again terminal branches of posterior tibial artery. Two terminal branches of the posterior tibial artery. The division actually is beneath the flexor retinaculum. Below the flexor retinaculum, they divide into the two arteries. The medial plantar artery is the shortest or the shorter version when compared to the lateral plantar artery. It is the reverse in case of the nerves. Okay. So deep again to the abductor hallucis. To the abductor hallucis deep too, and it will be accompanied by the trunk of the medial plantar nerves on the lateral side. So lateral side, so both the arteries are actually marginal in nature. They are marginal to the nerves. Okay. So the artery provides muscular branches mainly to the abductor hallucis and flexor digitorum brevis. Abductor hallucis and flexor digitorum brevis. Then it gives a superficial stem by dividing into two branches. One passes distally along the medial border of the great toe, and it will anastomose with the first metatarsal artery. Okay. So it will anastomose with the first metatarsal artery. Anastomosing with the first metatarsal artery, termination of the medial plantar artery. Then what happens is the rest gives superficial branches which will anastomose with the remaining second or first to the third plantar metatarsal arteries. Okay. So muscular branches, I told you it will do to the abductor hallucis and also to the flexor digitorum brevis. Three superficial branches, they anastomose with the plantar metatarsal arteries, which is going to be given by the plantar arch. That is about the medial plantar artery. The next artery which we are going to see is the lateral plantar artery, larger terminal branch of the posterior tibial artery. It passes forwards and laterally. So it is passing forwards and laterally between the two layers, first two layers of the muscles, and accompanies the lateral plantar nerve. Okay. And accompanies the lateral plantar nerve on the lateral side. This is on the medial side, this is on the lateral side. Both the arteries are actually pushed to the periphery when compared to the nerves. Okay. And on reaching the base of the fifth metatarsal, it divides into a superficial branch and a deep branch. The superficial branch supply the lateral side of the sole and the little toe, and it also anastomoses with your lateral tarsal and arcuate arteries. Remember these dorsalis pedis artery branches. Thereby it is taking part in the lateral malleolar network. If you look at the deep branch, okay, so superficial and deep branch at the region of metatarsal, this is supplying the lateral side of the little toe and lateral part of the foot and anastomosing with the lateral tarsal and the arcuate arteries, which are branches of dorsalis pedis artery. Then the deep branch, what happens is it runs forwards and medially as the continuation of the main trunk, and it is present beneath the oblique head. So you are able to see the oblique head of the adductor hallucis, and when it is reaching the first dorsal interossei, it pierces the gap between the first dorsal interossei, two heads of the dorsal interossei, and thereby what happens is it terminates by anastomosing with the dorsalis pedis artery, completing the plantar arch. The plantar arch will be completed by the dorsalis pedis artery. That is about the deep branch. So mainly muscular branches to all the rest of the muscles, anastomotic branches between the arcuate and lateral tarsal artery, taking part in the lateral malleolar network. Then it gives posterior perforating arteries, which anastomose with the dorsal metatarsal arteries. Okay, the dorsal metatarsal arteries, thereby through the perforating branches, it has got proximal and distal perforating branches through which it anastomoses. Okay, superficial branch of the lateral plantar artery supplying the digital artery to the lateral side of the little toe. Then from the plantar arch, it will give three plantar metatarsal arteries. So that is the course of the lateral plantar artery. Three plantar metatarsal arteries which is given. The lateral plantar artery will anastomose with the dorsalis pedis artery to complete the plantar arch by passing between the heads of the first dorsal interossei muscle. So the plantar arch you are able to see here, it is convex distally across the metatarsals, second, fourth, across the second, third and fourth metatarsal bones, and intervenes between the third and fourth layer, the deep branch. So mainly perforating branches, you have the proximal perforating branches, they ascend through the gap between the dorsal interossei and anastomoses with the corresponding dorsal metatarsal arteries. You also have distal perforating branches. So that is what happens, the posterior perforating branches which you have already seen as branches of the medial, as the branches of the lateral plantar artery. So perforating branches, then it gives plantar metatarsal arteries. Plantar metatarsal arteries to the interdigital spaces. You can call it as common digital and then divides into proper digital arteries to supply the adjacent sides of the toes. The first plantar metatarsal artery sends actually a branch to the medial side of the great toe. Thereby it anastomoses with the termination of the medial plantar artery. First plantar metatarsal artery. Okay. So that is about the plantar arch. Perforating branches joins with the dorsal metatarsal arteries, and plantar metatarsal arteries you are able to see here, they are 4 in number. first, second, third and fourth, of which the first one goes and supplies the medial side of the great toe to anastomose with the terminal part of the medial plantar artery. Nothing much is about the applied anatomy of the sole of foot, because mostly they are soft tissue structures, muscles which are present. One is called as the Baxter's neuritis, or also called as the distal tunnel syndrome, which will affect your lateral plantar nerve. So, entrapment of the first branch of the lateral plantar nerve is actually called as Baxter's neuritis. So, it will mimic the pain for plantar fasciitis. The same symptoms of plantar fasciitis you will always see when there is a nerve entrapment of the first branch of the lateral plantar nerve, which is actually called as the Baxter's neuritis. Next is plantar reflex. So, when you strike the sole of the foot with a blunt instrument, the lateral margin of the sole of the foot, when you strike, then you will see there will be a plantar flexion of the toes. All the 4 digits or the 5 toes, there will be plantar flexion and inversion of the foot. If the toes fan out, instead of plantar flexion, if the toes fan out, there is extension which is called as positive Babinski sign, which is due to the upper motor neuron lesion. So, whether which segments, mostly the S1, S2 segments you can test. Most of the tendon reflexes are mainly to test the segments of the spinal cord, whether there is any lesion. So, it shows Babinski sign, which is an upper motor neuron lesion. There is a lesion in the spinal cord at the sacral levels or beyond that, above that. But in children or infants which are below 1 to 2 years of age, this reflex is present. That is, the Babinski reflex is present. So, you should not mistake it for a positive Babinski sign in infants, because here what happens is mainly the myelination is not complete, and since it is a growing foot, the Babinski reflex is present, which is primitively present here, not to be mistaken for this one. So, that is some of the applied aspects, and with this we complete the sole of the foot. Thank you very much for your patient listening.